Frank, a 74-year-old retired engineer, sat across from me with a puzzled look on his face. "Doc," he said quietly, "I've been doing this the same way for decades, but lately, something just feels off. My body isn't responding the way it used to." He wasn't sick. He wasn't on new medication. But like so many men over 60, Frank didn't realize that the habits we form around masturbation, how we touch ourselves, how we think about pleasure, even how we sit, can quietly start to backfire as we age. This video isn't about shame. It's about awareness, because the things you did at 40 might be harming you at 70 without you ever knowing. Let's walk through the 7 most common masturbation mistakes older men make and how to fix them before they affect your energy, your confidence, and your long-term health. Over the years, countless older men have opened up about the changes in their bodies, not just the physical ones, but the emotional weight that comes with feeling disconnected, unsure, or even embarrassed by what's happening. If that sounds familiar, you're not alone. And more importantly, there's nothing shameful about aging, only in pretending your body doesn't need new care. This channel was created for men like you men who want to stay strong, confident, and deeply connected to themselves. So if you're ready to age with strength and self-respect, tap that subscribe button, hit the bell icon, and stay with me through this video. You may find that what's been bothering you is more fixable than you ever imagined. Mistake number 1, using porn as the main source of stimulation. For many older men, the shift happens so gradually they hardly notice. One day touching yourself feels good, natural, familiar. But over time, something starts to change. The sensations dull, the connection fades, and eventually you find yourself watching more and feeling less. This is what often happens when pornography becomes the primary source of stimulation during masturbation in later life. It's more common than you think. In fact, many men over 60 have quietly replaced real physical touch with endless scrolling through adult content, not out of addiction, but habit. It's easier, it's instant, and it doesn't require as much energy, but the consequences are subtle and deeply damaging. Here's why. As the body ages, the dopamine system, the part of the brain that responds to pleasure and motivation, becomes more sensitive to overload and less able to reset. High-intensity videos, fast edits, and constant novelty flood that system with stimulation it was never designed to handle, especially in your later years. The result? The brain begins to adapt, and not in a good way. It slowly reduces its own responsiveness to stimulation. What once brought satisfaction now feels flat. What once sparked desire now needs more effort, more intensity, more time. You're not broken. You're overstimulated. And the tragedy is that many older men start blaming themselves. They assume it's just aging, that they've lost their drive or their manhood is fading. But in reality, it's the dopamine burnout from repeated excessive visual input. Even more concerning, this kind of mental overstimulation often leads to physical detachment. You become less aware of your body. Touch feels less interesting. Arousal feels mechanical. You may still climax, but the emotional satisfaction is gone. And the longer this pattern continues, the harder it is to return to genuine, grounded connection, even with yourself. So what's the fix? You don't have to swear off adult content forever. But consider pausing for a while. Give your brain and body time to reset. Focus on real touch. Use your imagination. Connect with your breath. Place your attention back in your body, not on a screen. At first, it may feel unfamiliar, even boring. But that's your nervous system rewiring itself, that sensation coming back online. And that's how you begin to restore something far deeper than arousal. You restore feeling. If you've been feeling numb, distracted, or disconnected during masturbation, this first mistake might be the hidden reason. Mistake number 2. Masturbating while sitting on the toilet. At first glance, it sounds harmless. A private moment, a locked door, a familiar routine. For many older men, the bathroom becomes the only space where they feel undisturbed, a place to release tension, escape stress, or simply be alone. And for decades, they may have used the toilet as their go-to place for masturbation. But here's what most never realize: masturbating while seated on the toilet, especially for long periods, can quietly undermine some of your most important systems. As men age, circulation becomes everything. Blood flow to the pelvic region supports sexual function, prostate health, bladder control, and even nerve sensitivity. But when you sit on the toilet often in a hunched, downward curved position, you compress the very area that needs freedom and oxygen the most. That pressure doesn't just affect your backside. It restricts arteries, veins, and nerves in the pelvic floor. It subtly reduces oxygen to the prostate. It tightens the muscles responsible for urination and climax. And if the habit goes on for years, the consequences start to show up in frustrating ways: post-urination, dribbling, groin, aching, incomplete bladder, emptying, or a sense of heaviness in the lower belly. And yet most men never connect these symptoms to what they believed was a simple private routine. Many think it's aging. Others blame their diet, their medications, or even their mattress. But for a surprising number of men, the real culprit is posture and pressure, and the toilet is the perfect storm for both. But the fix, it's refreshingly simple. You don't need fancy equipment or new habits. You just need to change the environment. If you've grown used to masturbating while seated, try shifting to a reclined position. Use a bed, a lounge chair, or even stand if balance allows. Let your pelvic region breathe. Give your body the space to relax naturally, not under compression. You'll likely notice changes faster than you expect: better blood flow, reduced pressure, a more satisfying climax. And over time, fewer post-bathroom frustrations that once seemed like normal aging. Your prostate, your bladder, your nerves, they're not complaining because you're getting old. They're quietly asking you to stop squeezing the life out of them. It's not about shame, it's about support. And when you change your position, you change the outcome. Mistake number 3, rushing through the experience. One of the most common patterns that shows up in men over 60 isn't physical, it's behavioral. It's the quiet habit of treating masturbation like something to get over with. A task, a quick release, a brief escape squeezed between distractions or obligations. But here's what no one tells you. Rushing through masturbation is one of the fastest ways to lose connection to your body. It often starts in younger years, hiding from kids, dealing with stress, or just moving quickly out of habit. And it carries into older age without a second thought. But your body at 65 or 75 doesn't respond the way it did at 25. What once worked fast now needs space, softness, and breath. When you rush, your nervous system enters a mild stress state. Your heart rate spikes, muscles tense, blood vessels tighten. Your mind becomes fixated on finishing instead of feeling. And in that state, the body does respond, but only partially. Yes, you may climax, but it's not the same. The afterglow is shorter, the satisfaction is thinner, and instead of feeling recharged, you feel flat, disconnected, or even emotionally empty. One man in his early 70s told me, "It's like I still go through the motions, but I don't really feel it anymore. It's mechanical." What he didn't realize, and what many don't, is that this habit of urgency trains the body to associate pleasure with tension, not relaxation. Over time, the brain wires itself to expect quick, shallow stimulation. That rewiring leads to reduced sensitivity, weaker erections, shorter build-up time, and more difficulty staying aroused, whether alone or with a partner. But there's a better way. One that starts with a mindset shift. Slow is not a weakness, it's a superpower. Try this next time. Set aside the idea of climax altogether. Turn your attention inward, breathe deeply, touch with curiosity instead of force. Let sensation rise and fall naturally without chasing a goal. Even a few minutes of slowing down can begin to rewire your nervous system, not just to perform better, but to actually enjoy again. And when you allow your body to fully participate in pleasure, the benefits go far beyond release. You improve circulation, balance hormones, and build emotional resilience. The truth is, there's no finish line anymore, just presence, just connection. And in older age, that presence becomes your most valuable resource. Mistake number 4, ignoring the pelvic floor. Most men over 60 can tell you how important it is to maintain heart health, watch blood sugar, or keep their joints strong. But almost no one talks about the pelvic floor And yet this hidden group of muscles plays a massive role in everything from erection strength to bladder control to sexual satisfaction. The pelvic floor sits at the base of your core. It's the muscular foundation that supports your bladder, bowel, and sexual organs. When it's strong and coordinated, things work smoothly, blood flows freely, erections are stronger, and climax is more controlled and fulfilling. But when it's weak or ignored, that's when problems quietly begin to show up. One man I worked with, a 69-year-old former cyclist, came in frustrated that things just weren't firing the way they used to. He was still active, ate well, and stayed on top of his medications. But he noticed more dribbling after urination, a softening of erections, and a dull ache in his lower abdomen after climax. He had never once thought about his pelvic floor. And why would he? No one ever taught him that this area needs just as much care and attention as his biceps or heart. But as we age, the pelvic muscles naturally lose tone, especially after years of sitting, holding stress in the belly, or bearing down during bowel movements or masturbation. When you combine that with the tendency to grip, push, or tighten during self-pleasure, the strain becomes even worse. Over time, this leads to poor bladder control, difficulty with full release, decreased erection firmness, and even numbness or pain in the genital area. The good news, this can be reversed. You don't need to become a fitness expert. All it takes is awareness and gentle engagement. Start by identifying the muscles you would use to stop a stream of urine. Those are your pelvic floor muscles. Practice tightening and releasing them while breathing deeply. Do this a few times a day, especially before or during moments of arousal, to reconnect the brain to that area. With consistency, you'll begin to notice improvements in sensation control and confidence. Your pelvic floor is like the foundation of a house. If it's strong, everything above it works better. If it's ignored, things begin to collapse quietly, one frustration at a time. Don't wait for leaks or loss of performance to start paying attention. This system is still alive, and it's asking for your care. Mistake number 5. Masturbating too often or not enough. Of all the questions older men quietly carry, this is one of the most common: am I doing it too much or not enough? The truth is, there's no universal answer. But what's clear after working with so many aging men is that both extremes can quietly take a toll on your body, your energy, and even your emotional stability. Let's start with overuse. When masturbation becomes a daily habit, especially out of boredom, stress, or routine, it begins to lose its grounding effect. Instead of being restorative, it becomes depleting. One man in his late 60s shared that he felt tired after every climax, like something was being taken instead of given. And that's not uncommon. Excessive masturbation can gradually irritate the prostate, drain essential energy, and blunt the body's natural drive. It also reduces your sensitivity to pleasure. The nervous system becomes dulled by repetition, and what used to feel rich now feels muted. You might still climax, but you don't feel deeply satisfied. Emotionally, this leads to a sense of emptiness that can linger far longer than the moment itself. But then there's the other side of the coin: men who stop altogether. Sometimes it's due to medication. Other times they simply lose interest or believe that self-touch is for younger people. But long-term abstinence can also create problems. Without regular arousal, blood flow to the genitals decreases. Nerve pathways become less active. Over time, this can lead to atrophy, the shrinking of tissue, and reduction of function, which then makes arousal even harder to achieve when the desire does return. In some cases, the longer you go without masturbation, the more disconnected you feel, not just from your body, but from life itself. One man who had gone nearly 4 years without any sexual activity told me he felt like that part of him had just shut down. His words were quiet, but the grief was loud. So what's the balance? For many men over 60, the sweet spot is once or twice a week, enough to maintain circulation, keep the hormonal rhythm in check, and stay emotionally connected to the body without overtaxing the system. But even more important than frequency is intention. Why are you doing it? How do you feel afterward? Your body speaks in rhythms, and if you listen closely, it will tell you when it's time to engage and when it needs rest. Masturbation in older age isn't about keeping up, it's about staying tuned in, and when you find your rhythm, not too much, not too little, everything works a little better. Mistake number 6, using too much pressure or force. As sensitivity begins to shift with age, many men unknowingly make a small adjustment that causes a big problem. They start using more pressure. It's understandable. You may not feel as much as you used to. The body takes longer to respond. And without realizing it, your hand becomes tighter, your grip firmer, your strokes more intense, all in the name of trying to recreate what once came naturally. But here's the truth. Most men never hear. Pressure doesn't bring sensation back. It pushes it further away. The tissue in the penis is delicate. The nerves just beneath the surface are finely tuned to respond to gentle touch and gradual buildup. But as we age, those same nerves become more fragile, more vulnerable to friction and compression. And when masturbation becomes an act of force, not feeling the results can be serious. Over time, excessive pressure can lead to micro tears in the tissue, loss of elasticity, and even nerve desensitization. This isn't about trauma. You can see it's damage that builds in silence. The skin becomes less responsive. Erections may feel weaker. And in some cases, men notice a subtle curvature forming caused by uneven tension or scar tissue that's formed beneath the surface. What's worse is that the cycle feeds itself. The less you feel, the harder you press. The harder you press, the more damage you cause, and the less you end up feeling. It's a loop that can be hard to escape once it begins. But there's good news: you can stop this cycle, and you don't need medication or surgery to do it. Start by experimenting with gentler pressure. Use lubrication if needed. Shift your mindset from chasing a result to exploring sensation. Think of it like tuning a musical instrument, delicate, precise, responsive to subtle shifts, not like pounding a drum. You might feel less at first. That's normal. It's because your nerves are still in defense mode. But with patience and consistency, the sensation often begins to return, slowly, softly. But it does return. And perhaps even more important than the physical is the mental shift. When you move from force to presence, your entire relationship with your body changes. It's no longer a performance. It becomes a conversation, one where your body can finally speak again. Your nervous system, your skin, your tissue, they're not asking for more effort. They're asking for care. And in older age, care is what creates connection, not pressure, not force, just awareness, gentleness, and time. Mistake number 7, masturbating without emotion, connection, or intention. This mistake is the hardest to see and the most painful to feel, because it's not about what you do with your hands, it's about what you do with your heart. As men age, many start to feel distant from their bodies. It doesn't respond the same way. Things take longer. Sensations change, and gradually, without realizing it, masturbation becomes mechanical, something done out of habit, boredom, or even loneliness, not out of connection. It's not always obvious. For some, it's just a part of the routine, like brushing teeth or making coffee. For others, it becomes an escape, a brief distraction from the deeper feelings they don't want to face: grief, isolation, the fear that no one touches them anymore. One man in his 70s told me that it had been years since he'd really felt anything. He still climaxed occasionally, but he said it felt like scratching an itch, not making a connection. His words stayed with me, not because they were rare, but because they were so familiar. Here's what happens when we masturbate without emotional presence. The brain stops releasing the full spectrum of healing chemicals. Dopamine becomes muted, oxytocin, the hormone of bonding and calm, barely shows up, and serotonin, which helps stabilize mood, doesn't reach the levels it could. So instead of feeling relaxed, peaceful, or reconnected, you feel empty, a little flat. And over time, that emotional flatness can trick you into believing your body is failing, when really, it's just longing for your attention. The solution isn't to stop, it's to return. Return to your breath, return to your intention. Bring emotion back into the moment, not guilt, not shame, but care. This is still your body. It still works just differently now. And it still deserves touch that is curious, gentle, and meaningful. Whether or not you climax doesn't matter. What matters is that you show up not just with your hand, but with your whole presence. You are not a machine. You are a man. And the quiet act of being with yourself, when done with intention, becomes a kind of healing, a daily reminder that your body still belongs to you. And when you stop going through the motions and start connecting again, pleasure stops being something you chase and becomes something you welcome. Final thought: reconnecting with the body that's still yours. If you've made it this far, you're not just curious, you care. You care about your body, about your health, about the quiet dignity that comes from knowing yourself fully, even as the years pass and things change. The truth is, aging doesn't mean disconnecting. It means learning to reconnect in a new way, a deeper way. Because the body you live in now isn't broken, it's wiser. And like anything wise, it asks for your attention, not your urgency. The 7 mistakes we've talked about: relying on porn, sitting too long, rushing the process, ignoring the pelvic floor, masturbating too much or too little, using excessive pressure, and doing it without emotion, they all have something in common. They're habits of disconnection. Not shameful, not wrong, just unaware. You've been doing things the way you always have because no one told you the rules change after 60. But now that you know something powerful is possible, choice. You can choose to slow down, to feel again, to let touch become healing, not hurried. To treat your body not as a machine, but as a home one that still needs care, intimacy, and respect. And maybe most importantly, to stop waiting for someone else to make you feel alive. Because the truth is that feeling is still inside you. It's buried under years of routine and silence and self-doubt, but it's there. The part of you that still wants to connect, not just with a partner, but with yourself. This isn't about performance, it's not about frequency, it's about remembering who you are, and how much wisdom still lives inside your skin. Your hand can still heal, your body can still respond, your presence still matters. You don't need to be 20 again, you just need to listen again. Start with something simple: a breath, a softer touch, a shift in posture, a moment of intention. These are not small things, they are powerful acts of self-respect. Because at the end of the day, masturbation isn't just about pleasure. It's about connection, to your body, to your energy, to the part of you that still wants to feel whole. And you deserve that wholeness not someday, but now.